My name is Phil Kim, and I'm an organizer with NNU's Medicare for All team, and I'm honored to introduce Zenei Cortez, a registered nurse and president of National Nurses United and its largest affiliate, the California Nurses Association. National Nurses United is the largest union and professional organization of nurses in the country, with over 170,000 members. Zenei, along with our executive director, Bonnie Castillo, also a registered nurse, has provided decisive leadership in the midst of the worst global pandemic in a century, an unprecedented time for all frontline healthcare workers. And since March, our union has fought for frontline nurses and healthcare workers by pressuring Congress to enact an OSHA temporary emergency infectious diseases standard and to fully utilize the Defense Production Act to produce more personal protective equipment, or PPE. Over 500,000 people signed our petition to Congress, and over 25,000 phone calls were made to members of Congress boldly making these demands. Our union has held multiple actions outside the White House and over 2,000 actions at healthcare facilities across the country. Because of this organizing, we passed our two key demands for nurses and healthcare workers in the House in May. And in March and June, we witnessed the murders of Breonna Taylor and George Floyd at the hands of the police. And since then, our union has led conversations around racial inequity from our hospitals to the streets. And we've made a concerted effort to make racial justice a key focus of our Medicare for All campaign. By midsummer, we saw the single largest spike in the number of uninsured people in American history because so many people lost their jobs and their employer-sponsored health insurance. So my conversation with Zenei today makes crystal clear why all these struggles are intricately connected and how NNU has provided unparalleled leadership in drawing these connections. Indeed, the pandemic and the experience of our frontline healthcare workers during this pandemic would have been significantly different under Medicare for All, as Zenei will discuss. And this crisis has made it even more apparent than ever before why we need Medicare for All now. So for my first question, Zenei, can you give us a brief overview of where we are today with the COVID-19 pandemic and how it relates to our healthcare system?
Hi, and thank you for having me here. We are at a petrifying moment. Globally, we are close to 100 million confirmed COVID-19 cases and almost 2 million deaths. The US is leading the world in infections with over 22 million confirmed infections and over 350,000 deaths. At the beginning of the pandemic, some claimed COVID-19 would strike all populations equally. This proved false. Nurses knew this would be false. As usual, low income and minority populations have been hit hardest. People of color get sick and die of COVID-19 at rates higher than whites and higher than their share of the population. Native Americans, Blacks, and Latinos are being hospitalized from COVID-19 at around 4 times the rate of whites and are dying from COVID-19 at about twice the rate of whites. Certain conditions increase vulnerability to developing complications from the virus. Conditions such as diabetes, heart disease, and obesity can worsen the course of COVID-19. African Americans are more likely to suffer from these conditions. Moreover, people of color are much less likely to have health insurance, and those who are insured are often underinsured, meaning that premiums, copays, and deductibles make accessing healthcare too expensive. The COVID-19 pandemic has forced us to acknowledge the enduring, destructive, and deadly economic and racial gaps in our healthcare system and society. People of color frequently receive worse healthcare for a multitude of reasons, from lack of affordability to racism. As a registered nurse, many of my patients are low income and BIPOC, meaning they are Black, Indigenous, or people of color. My patients are suffering and dying because our country has failed to provide basic health care, particularly to communities of color. The American healthcare system was not ready for this pandemic because its aim is not healthcare or equitable outcomes. Instead, it is a fragmented, profit-driven system that frequently forces people into debt. Despite the gains of the Affordable Care Act, there were close to 29 million Americans who had no insurance before the pandemic. An estimated 20 million people lost their employer-sponsored health insurance as a result of job loss during this pandemic. As a result, many who needed testing and care for COVID-19 did not get it, thereby allowing the virus to spread. This remains true. Individuals, particularly the poor and the most vulnerable who are sick, don't get the care they need because of the outrageous monetary cost. Medicare for All is important because it not only guarantees healthcare to everyone free at the point of service, but will also be one step in the right direction of helping us combat systemic racism.
Before we talk about the importance of Medicare for All, I wanted to ask you, Zenei, and especially for nurses and frontline healthcare workers, how are you all faring during this pandemic?
We are not faring well. As of January 8th, 2021, 292 registered nurses have died due to COVID-19. An additional 2,733 healthcare workers have died. Horrifically, 644,113 healthcare workers have been infected. These numbers are an undercount because there is no central reporting for this information. We have these numbers because my union have been collecting them. But this is unsurprising. I have been a nurse for over 4 decades. In that time, hospitals, healthcare systems, and healthcare delivery have dramatically changed. I have witnessed hospital administrators increasingly force profit margins at the expense of patients' needs. In recent decades, corporate hospital chains have engaged in buying and then closing hospitals deemed not profitable, often in rural areas and in predominantly Black and poor urban areas. Over the last decade, we've witnessed about 680 hospital mergers. The result is a drastic decrease in hospital beds from 1.5 million in 1975 to 900,000 today. Additionally, hospitals have failed to ensure enough personal protective equipment to frontline staff because stockpiling these was also seen as unprofitable. And years of failing to staff properly has left units without enough nurses to provide high quality care. The result of this endless pursuit of profits has brought us here, leaving many of my sisters and brothers ill with COVID-19. As a nurse, it's a frustrating and scary time. A key component of stopping the spread of this virus is to ensure that frontline healthcare workers are provided adequate protection. At a time when we should be looking after each other and building our communities, hospital executives and politicians are selfishly and greedily putting healthcare workers at risk of infection and death to increase their bottom line.
Thank you for sharing that. Now, Zenei, earlier you briefly touched on Medicare for all. So I want to ask, why do you feel healthcare reform, and specifically Medicare for all, is essential in combating this pandemic?
COVID-19 created a public health crisis, but people in our country have been living in a public health crisis for decades because of our inadequate healthcare system. Our healthcare system is convoluted and leaves people to suffer in the best of times. It creates incentives to raise prices and push up patient volumes. It poorly compensates services such as primary care and behavioral health, creates an undersupply of services in poorer and rural areas, and ties our health insurance to our employment. Before the pandemic, most Americans relied on employer-sponsored health insurance for healthcare. Despite this, approximately 87 million Americans either lacked insurance or were underinsured. And about half of those with employer-sponsored health insurance had either delayed or postponed needed treatment for themselves or their family because of cost. As I mentioned, about 20 million lost employer-sponsored health insurance in 2020. Unemployment remains high and more are expected to lose health coverage. During the largest pandemic in a century, lack of insurance is forcing individuals to skip medical treatment for the virus and for other serious ailments. Even those with insurance, care is unaffordable. One poll found that 68% of adults said that out-of-pocket costs related to treatment would factor in their decision of whether to seek treatment for COVID-19. And this is pretty serious. Foregoing treatments hurts everyone. It prolongs the pandemic and increases morbidity and mortality. But as always, not everyone is suffering. Many hospitals and private insurers profited in 2020. United Health Group posted an additional $4.1 billion in revenue during the first quarter of 2020. While Americans are getting sick and dying and healthcare workers are risking their lives, hospitals and private insurers are making record profits. This is the norm with healthcare in America. People suffer and die while corporations and the 1% make millions, if not billions. COVID-19 intensified racial inequalities and highlighted the long-standing systemic racism embedded in our healthcare system. Our healthcare system disproportionately fails to insure people of color. As I mentioned, people of color are suffering from COVID-19 at higher rates and are more likely to be uninsured than white people. Before the pandemic, about 62% of white people had private coverage, compared with under 50% of Black people. Lack of coverage results in higher prevalence of chronic illnesses that leave individuals vulnerable to the devastation COVID-19 creates. Systemic racism also plays a role in treatment. One statistic revealed that Black patients presenting with COVID-19 symptoms, such as a cough, were less likely to be referred for a test. Finally, people of color are more likely to receive treatment in safety net facilities. Disparities in health access and outcomes are embedded in our healthcare system and reflect a history of racism characteristic of society. Medicare for All is an important step in remedying all this. It would not single-handedly stop COVID-19 or eliminate racism, but it's an important step in protecting individuals. Medicare for All would cover everybody with comprehensive, high-quality care, ensuring anyone who gets sick can see a doctor. It would improve access to primary and preventive care services, which could reduce the prevalence and the severity of chronic illnesses that exacerbate the health effects of various illnesses. Medicare for All allows everyone to receive vaccinations, including the COVID-19 vaccine, with no cost sharing. This is because the government will be the single payer, giving it negotiating power needed to command the lowest possible drug prices. Medicare for All will also de-link healthcare from the workplace, ensuring people who lose their jobs will still get healthcare, but also freeing up that money to go to things like better wages, benefits, and other workplace protections. Finally, Medicare for All will change how hospitals are reimbursed, replacing the confusing and inefficient mix of multiple public and private payers with a single publicly financed payer that ensures hospitals have the money they need to stay open regardless of location. A publicly financed system also ensures that money is used for patient care, workplace safety, and increasing capacity rather than lining the pockets of executives.
Yeah, definitely seems like the obvious solution. Now, I'm curious, do you think that Medicare for All could have prevented the COVID-19 pandemic?
No, but this pandemic was entirely preventable if our country had effective leadership, screening, monitoring, and funds allocated to pandemic preventions. Medicare for All would have been an important component of that. Medicare for All would have helped plan, coordinate, and save lives. It would ensure that anyone experiencing the slightest symptom would not have to worry about the cost of a test or care. It would ensure that hospitals in all areas can remain open, and we would not be facing a critical shortage of beds. We would be more likely to have adequate stores of personal protective equipment on hand, or at least the ability to obtain adequate PPE quickly as part of a coordinated pandemic response. Indeed, most importantly, our effort to curb this pandemic would be coordinated. Medicare for All is a very powerful tool in the time of a public health emergency.
The last question I'd like to ask is, where do we go from here?
We must use this moment to organize and fight for Medicare for All harder than ever before. As this current surge worsens, we must fight to ensure that healthcare capacity is expanded and is available to everyone. People must be able to get treatment when and where they need it, and we must ensure the safety of nurses and other frontline healthcare workers. We must advocate for the safety of nurses, healthcare workers, patients in our community. Winning Medicare for All is a key part of that advocacy. To join us in our fight, please go to bit.ly MFA join. To find out more about the next steps, join us in our next National Medicare for All strategy call at bit.ly January 21 call.
Okay, thank you, Zenei. I'm looking forward to it. And thank you so much for your leadership.
Thank you.